subspecialize in neurology, more specifically in neuroimmunology. I deal with diseases or inflammatory conditions that affect the brain and spinal cord primarily. Some of those diseases include like multiple sclerosis or NMOSD, and others including autoimmune or paraneoplastic disorders. When a patient comes to visit me, I like to hear their story. I want to hear how they've experienced their illness, how it's affected them in their day-to-day lives, and how it's evolved with time. I always tell patients that I'll do like a deep dive before they even come and see me. I try to review their records, look at all their other consultation and lab results. But there's nothing that can replace hearing from the patient their experience of a disease. And so that's kind of how we like to set that foundation at initial visit. The diseases that I treat commonly affect patients in their 20s, 30s, even 40s. So at the prime of their lives, right when they're about to embark on a career, start families. And it can be really devastating. And to be able to intervene at that time, to be able to offer them some hope and to give them that plan forward, there's nothing more rewarding than that. In neurology, but specifically neuroimmunology, there's very rarely a right approach. And so the one that works with the patient and their families is the one that we can kind of collaborate on together. My inspiration was kind of twofold. You know, I get to see this really wide berth of kind of clinical pathology and cases, and it always has kind of sparked my curiosity. And two, the multidisciplinary approach to care in these really complicated cases is always really engaging. I get to collaborate with imaging experts or neuroradiologists. I get to collaborate with rehabilitation experts like physical and occupational therapists. And I get to meld with mental health experts like psychiatry and psychology. And I find that collaboration really engaging. Outside of the office and hospital, I enjoy reading historical fiction. I kind of enjoy being transported back in time to kind of these different cultures. It's humbling yet gratifying, and it gives me a little bit of hope for the future.